May I invite Dr. Ajay Kumar, Assistant Professor of Psychiatry at AIIMS-Raipur, to talk on digital logbooks in the area of digital technologies, particularly during COVID. It's become very exciting to actually have everything digitally documented. And let's listen to Dr. Ajay Kumar about the digital logbook.
Thank you, madam. Good evening. And after the presentation of my previous speakers, Dr. Kishore and Dr. Hinal Shah, my presentation is much easier because I will be discussing about the little bit of technical part of the assessment and the this thing. So I will start my topic. The topic is use of digital logbook in psychiatry training. So I will start with the definition of logbook as per the Medical Council of India. Logbook is considered as a verified record of the progression of learner, documenting the acquisition of the requisite knowledge, skill, attitude, and competencies. The Medical Council of India provide the scope that it is considered as an integral part of the formative and continuous assessment program. If we look at the situation of a logbook in the hierarchy of assessment tool, as it discussed by the previous speakers, we have a battery of assessment to assess the various area of training. So we have basically two type of assessment system. One is summative assessment, which is a high stake exercises, and we have continuous a formative kind of assessment, which continue throughout the progress of training. And then top of it, we need to record all these activities, whatever the student is doing, that we do with the help of logbook or a portfolio. So if we see the logbook, by and large, logbook comprises the three major parts. It should comprehensively illustrate the training program so that a student become more oriented towards the training. He knows the his journey and the important milestone to achieve, and then the student will record or share his experience with the help of logbook. And as madam has mentioned, the importance of feedback, this process has to go in hand with the timely feedback. Now, Medical Council of India provided a scope of using electronic form of logbook. And the concept of e-logbook is not very new to the medical science. Many other specialties are already using it, although we, as a psychiatrist, has a little bit limited experience. Okay, so first we try to understand the state of traditional logbook. Although despite the wider recommendations, the implementations of the traditional logbook is not very good, and it is highly underutilized because of the poor documentations and the other factors. The reliability and validity is often being questioned. The effectivity of traditional logbook in the learning or even improving in the clinical training is not very well established, although it is found that it improved the communication between the teachers and the student. As a stakeholder of the logbook, student perspective is very important to understand. The student consider it as an invalid assessment tool, and they consider it as a time-consuming and stressful exercise. They consider it as a boring and repetitive work. We know that we, as a student, we all have experience that we have multiple files to do, multiple registers, admission register, discharge register, and most of the time goes in that. And you know, the training of psychiatry itself so hard, so that sometimes the student do not get time to proper sleep and eat. And most of the time, students do not know the importance of recording the activities. The student consider it as a bureaucratic process, and the conclusion is they do not accept it. If we take the teacher's perspective in the account, then it is found that the underreporting is a major problem or limitation. Because of that, we are not able to use a logbook as a proper assessment tool, especially for the high-stake assessment. Lack of time is other limitations. Because of that, the teachers is not able to provide the proper feedback and even not able to scrutinize the process. So yeah, so even there is hardly any consequences when the logbook is not completed. Now coming to the electronic form of logbook. So basically we can have two type of logbook. One is offline kind of a logbook, another is a online type of logbook. Offline kind of a logbook is very easy. I think many of the institutions already using it. It is a very cost effective process, and here the student has to log his activity in a particular computer. We do not have much privacy and security issue with it. There is no involvement of third party. Only thing is we have to secure the data somehow. So this is a model which is already in use of one of the criminal institutes. Here the student, whenever posted in a particular clinical area, has to make entries. These are the clinical entries like number of patient and the diagnosis of the patient and number of psychotherapies and number of ECTs done. So these all quantitative data is there. Along with that, we can have a academic data like number of seminar, number of general club that also can be maintained with the help of senior resident or the faculty. And when the same thing will be repeated when a student shift from one clinical area to the other clinical area. Now, when we pool this data, we can analyze the data and we can understand which area the student is lacking, and some kind of a constructive feedback has to provide it to the student. As Madam had mentioned, that we have to develop a culture of feedback in the department, so that it has to be at periodic, timely exercises, so that the difficulties of the student can be addressed. I want to say that this data is not only for the student feedback. This is a very important data we can utilize for multiple purpose, because if we maintain it very well, this data, same data can be utilized for the administrative purpose, for the research purpose. Now come to the online kind of a e-logbook. Basically, here we have a commercially available web-based app, or kind of a personal digital assistant system. Most of the students use it, and here a student has to create a profile, and he can log into the profile by using username and password. The important thing is that a student can log his activities from anywhere, from any device, and anytime. So some of the data will be shared to the third party here, because we are hiring a third party for storing our data. We can have some kind of a privacy and security issue here, but the data is more secure because we use cloud. If we use cloud, so here we have lots of scope. Basically, here this system can be expanded to any extent. Like if the university has 10 medical colleges, a uniform e-logbook can be used across the 10 medical colleges, and every faculty, every student will be connected and will be knowing what happening to the other institute. So lots of transparency is there in a cloud-based system. So here is some of the commercially available e-logbook, and several of them is utilized by the surgery and the gynecology and the pediatric department. Maybe they've utilized more e-logbook because they have more procedure to do. Now, evidence, what evidence we have about the e-logbook? E-logbook or digital logbook is better accepted among the student, and it is found to have important, it has role to provide in constructive feedback to the student. Some of the researchers says that it improve the quality of training and better the outcome of the training. It also has flexibility so that it can be upgraded with the upgradation of the newer technology. We have limitations also, because e-logbook, again, the teacher says that they do not have time to provide feedback. Resources we require, as highlighted by Madam, and we have to have internet connectivity and then some amount of computer literacy is required from the student and from the teachers. And some of the teachers are quite conservative about the development of new technology, and they consider the traditional method is much more better. So with this, as it has been highlighted that rapidly changing there's a rapid change in the medical training. We can think of a system. It's kind of a smart e-logbook, which can pave the way of a futuristic psychiatry training. And there's a possibility that it can happen. One day, whenever there is a new patient in the ward and it is allotted to a particular student, the student may get a notification. The academic schedule may get automatically synchronized with the e-calendar, and the student have a better orientation and better time management. If we provide extensions to the e-logbook with the e-learning tool, then e-learning also will be done with the help of this. Because a group of students are connected to the same system, peer group assessment and the faculty assessment and the multiple faculty assessment, so it is more valid assessment when there are more number of people involved in the assessment. All the leaves, absence, and the other academic activities also can be stored. So it can be a platform where the all activity can be stored and can be analyzed. Top of it, a student able to see the real-time progress in a graphical manner so that he can compare his or her performance with compared to other. So it can be a very motivating to him. We can provide lots of other extension. I'm sure that all of you will be having lots of ideas, and because there are immense of possibilities with it. So we can even provide extension for like assessment tools for burnout, depression, suicide. Whenever the student goes through the screening and he score higher, the notification goes to the concerned authority. So the help can be reached to the students. So we can have lots of possibility with this. So with this positive note, I will conclude my presentation. It's a very short presentation. I want to thank Dr. Kishore, who gave me this idea of on working on e-logbook. And I have worked with Dr. Suhas Chandran. Thank you.